discovery and how we are moving from accidental. Good morning, everyone. Thanks for David and Kevin for inviting me to present and share with you my discovery and how we are moving from accidental discovery in the lab to a device that can save millions of people's teeth around the world. So this is myself. I work at University of Alberta in orthodontics, and also I'm a private practitioner in outside. I have a private office, and also I have a PhD in bioengineering. In 2006, there was a huge media release. Inventor researchers patent new technology that can regrow teeth, and hopefully in a few years we can reach that claim. But a device that can help you grow your own teeth, broke a tooth, grow it back. So this is true. I'll share with you what we have and where we are and the future. Okay, so this is the accidental discovery in dental research. Basically, if you are familiar with distraction osteogenesis or surgical bone lengthening, so if someone has a short bone, like this girl, for example, this leg is short. So what they do to lengthen this short leg, they cut it, put a screw in it, and then they open the screw every day, and then in few months the short leg can be as long as the normal leg. Okay. In craniofacial area, we are dealing with lots of problems, especially with the lower jaw. When the lower jaw is underdeveloped like this, we can do the same thing, the same technique. We break the jaw, put a fixator with a screw in place, and then after a few weeks, then the patient move from here to here. And basically, the whole idea is to regenerate or grow the patient's own new bone without the need for any hip or any bone graft or any other materials. The only problem with this technique in the craniofacial area, usually we hope to get the bone from here to here, but most of the time the bone doesn't grow in the direction that we have. And most of the time it grows in different directions, and the output or the resultant bone shape is not what we are actually planned for. So we try to look into something that can promote the bone healing at this distraction site or at the bone fracture site. So we looked at different non-invasive techniques, and ultrasound was the best one or best solution that's been used in clinical trials and in the lab for almost 30 years to promote fracture healing or bone, to help healing of fractured bone. So we have three types of ultrasound, just to introduce you briefly what ultrasound, because lots of people get confused about the sonar that's being used and the shock waves. So there are three types of ultrasound, depends on the power. The shock waves that can use diagnostic, that's this diagnostic that lots of pregnant women can use to check their babies. And operative that can crush kidney or renal stones, and it has lots of power. And the therapeutic one that's mainly used in physiotherapy, and this is the one that we are going to talk about its application in dentistry today. So the first research that I did was at University of Illinois, and that was my PhD, was to evaluate a commercially available ultrasound device that's been used to help healing of fractured bone on bone maturation during mandibular or lower jaw distraction osteogenesis or lower jaw surgical lengthening. As you can see in this rabbit here, we cut the lower jaw, we start to lengthen or open the screw, and then we hope only new bone to be filled in this space here. And this is where the cut was. And when I did the cut, I cut the lower incisor as well. And we were really excited to see what's going to happen to that lower incisor. And then after a few days, you can see the side that treated by ultrasound, the tooth was growing more than the other side. And that was a big discovery, and I got lots of criticism from my supervisor. What did you do to this poor rabbit? Nobody will believe you. You will present this in an improper research book, and lots of funny stuff. And then until 4 weeks after this discovery, we did the histology, and then this is the new bone that you can see here. And in the middle of the gap, we had a new tissue that it's not bone. And on a higher microscopic level, you can see or if you're an expert in the dental field, this is new tooth that's been formed at this destruction site. That was the first time in history that we can show people that new dental tissue can be formed in few days. Again, rabbit's teeth are different slightly from human teeth, okay? So there was lots of criticism how to apply this into clinical trial or in human. So basically, the results of this research that ultrasound can generate new dental tissue formation, and this new dental tissue formation is dentin. And dentin, basically, it makes the bulk of the tooth, and cementum, which is the outer layer that attach the roots of the teeth to the bone, okay? So these two main parts can be regenerated by ultrasound in rabbits, not the enamel yet, because the enamel is a different story. So in orthodontics, when we move teeth, there are lots of risk factors that a big chunk of people can get into big problem that's unresolved at this moment, which is root resorption or root shortening. So when you have braces for 3 or 4 years, if you are one of those high-risk patients, what can happen? The roots can be gone like this. So there is no roots. So the tooth can start like this, and then after 3-4 years, the root is being blunted and get shortened. This is a real case that's been sent to me on daily basis, one of the cases. And also on other patients from UK, all over the world, they have this problem, and there is no treatment for those patients so far. So we started a clinical trial, pilot clinical trial on patients that they have braces, and in some patients that they are going to have braces, some of them we have to take some teeth so we can have spaces so we can straighten up their crooked teeth. On those patients, the teeth that to be extracted are always good candidates for us to do some research on them because the patients are going to lose them anyways, right? So yeah. But we had also hard time recruiting patients because most of them, they are excited to get into the braces. We want to finish the braces so and so anyways. So we're successful in getting some patients. And we start to apply some forces to induce root erosion or root resorption. And on the other side, in each patient, we apply the commercially available ultrasound device. You can see the applicator here is big like a Tony. And it wasn't actually comfortable for the patients to apply it. But I was lucky to get really good patients or compliant patients to use this commercially available device. After 4 weeks, the teeth that didn't receive ultrasound, you can see the erosion. This is the cementum layer here, and also the dentin get eroded, and this root as well, you can see the erosion everywhere. But interestingly, after 4 weeks, when we apply the ultrasound here, new dental tissue was formed, new dentin and new cementum. That was, again, the first time in history that we can show that new dental tissue can be formed in 4 weeks. And that was published in the American Journal of Orthodontics. So we start to move more higher to higher forces because when we did this pilot study, we were aware, like we had to be very careful not to apply too much force so the patient don't get severe pain and stuff. Now we're confident enough to apply huge amount of force and see what in the real life, what's going to happen. So this is what happened. This is at the University of Alberta. A patient came for the same experiment, and then we apply huge amount of force, like almost 13 times the original force that we applied. Just try to imitate the real time or the real life orthodontic force application. And then when we apply ultrasound to this site only, you can see the root was preserved here, but the inside root was severely resorbed, and the control root or the tooth that's been moved without any ultrasound, the two roots get shorter compared to the preserved root here. So that means the ultrasound really works. So we have lots of patients that have been send us emails, photographs of their x-rays, photos on daily basis. You try to save the roots. So you can see millions of patients worldwide, they have these problems. Like if I get a patient that with the teeth roots look like one of those forms, these patients are at high risk of root resorption. But what happens in a heavy, crowded private practice, Some orthodontists see between 60 to 120 patients a day. They overlook some of those patients. And what happens after 6 months of treatment, when the patients start to say, oh, my teeth are really, really moving, they take the x-ray, and this is what happens. The root is gone. So there is no one single treatment for those patients other than taking out the braces, and they live as is forever unless their tooth can be saved by root canal treatment, or most of them, they have to take their teeth out and they can have their teeth replaced by implants. So we'll start to do another test in the lab, on again back to the rats. And basically we induced fracture. Like if a patient like the hockey people, when they get trauma, most likely what happens when their teeth get broken, most likely like Ryan Smith a few years ago, he lost his teeth, but part of the teeth were still inside the jaw. But what happened, they just took out the rest of the teeth and then put implants in. So right now we try to imitate what happens if you get a trauma, or someone get a trauma in their teeth and the teeth get fractured. Can we save the natural teeth without replacing them with implants or bridges? This is what we are trying to do right now in the lab, and we are successful to show that ultrasound only, without any medication, without any stem cell, without any growth factors, can actually regenerate the fractured roots in the lab. And again, in human teeth in the lab, we imitated fractured for the roots, and after 4 weeks, the roots get healed. As you can see, the difference between the fractured and the regenerated roots. So we had to move further because the company that produced this big ultrasound device, they are not interested in dental application. So I was lucky when I joined the University of Alberta to join two peers in electrical engineer, and we start to put together a micro or nano-fabricated device that can be used solely for dental use. And then we had Christy on board, that he was master's degree at the time. And then we are moving right now from proof of principle to a clinical trial, hopefully in 2 years. So this is the new device that it's been fabricated by Smile Sonica. This patent has been licensed to Smile Sonica, which is a spin-off company. And this device, again, it addresses lots of patients' worry. The patient can preserve their own teeth, and the orthodontist or dentist can save their faces and minimal potential litigations against them. Again, this device has been licensed to Christian, Smile Sonica, and since 2 years, they have developed or raised more than $200,000, and hopefully in a year, or 2 years, we'll get to real clinical trials in patients. So I hope I made it on time, and I'm ready for questions.
Any questions? First question there.
Yeah. Insight as to the mechanism?
Oh, for sure. The mechanism, basically, after the first publication in 2002, 3 groups of researchers appear in the world, Japan and US and UK, and they uncovered the genetic background of it. And basically, ultrasound stimulates specific genes that's important for dental matrix formation, as well as also stem cells. So we're working on both sides right now, and stem cell differentiation into tooth-forming cells, and also dental matrix formation specific genes.